Director with the Committee to Protect Healthcare. Thanks so much for joining us today. As you know, members of the U.S. House are back in district this week for recess, and physicians are calling on them to use this time to answer for their support for massive cuts to Medicaid. The physicians joining us today will share how these cuts could impact their patients and communities, and why their representatives should cease further support for cuts. Please note that the physicians speaking today are speaking as individuals, not necessarily on behalf of any employer. So we respectfully ask that you refer to them in any coverage as they introduce themselves and not include employment information if they do not include that. So thank you in advance for being respectful of that. We are also recording this, and I can share the recording after the call is over if that would be helpful for your coverage. Without further ado, I will introduce our first speaker, Dr. DiGiovanni.
Good morning. I am Dr. Susan DiGiovanni. I am a board certified in internal medicine and nephrology. I practice in Midlothian and in Richmond, and I've been a physician for over 40 years. I'm a constituent of Representative Rob Whitman in Virginia's 1st Congressional District. My fellow Virginia physicians and I are gathered today to call on our representatives to answer for their support for cutting Medicaid and taking away health care from our patients. Our representatives are back in our districts this week during congressional recess. So what better time to talk to the constituents about their votes paving the way for Medicaid cuts? This sort of transparency and accountability is particularly important right now because some of Virginia's representatives have been avoiding their constituents. Here in Virginia's 1st Congressional District, Representative Whitman has been largely avoiding public events, even his own scheduled office hours. In fact, he even removed some mobile office hours from his website. So during the in-district work period this week, we hope Congressman Whitman will finally listen to constituents like me. Along with my fellow physicians, I'm gravely concerned that Congressman Whitman voted for the budget resolution paving the way for enormous Medicaid cuts. Medicaid, or Cardinal Care as many know it here in Virginia, is a popular and critical program that provides health care for many of my patients and for many of our most vulnerable Virginians, including children, working families, low-income seniors, and people with disabilities. Medicaid ensures that low-income kids can get their annual physicals, visit the dentist, receive behavioral therapy, and more. Medicaid helps low-income seniors get home care or nursing home care. Medicaid ensures that people with disabilities and chronic illnesses who often cannot work and thus can't get insurance through an employer are able to access the health care they need. The budget resolution Congressman Whitman voted for could put care for all these people, my patients, on the chopping block. If these Medicaid cuts become a reality in Congressman Whitman's district, 124,980 people could lose their health care. More than 56,000 children in our district could lose their health care. I apologize for that. Excuse me, I lost my place. As could 11,000 seniors. I've seen what happens when patients lose their healthcare coverage. I was following a patient with well-controlled diabetes. He's lost his Medicaid benefits because he made slightly more than the income allowed, even though his employer did not offer health insurance and he could not afford insurance off the marketplace. I saw him 2 years later in the hospital emergency room with gangrene of his foot. He ended up needing his leg amputated. His hospitalization cost over $100,000 in the end. I cannot say for sure that the outcome would have been different, but more than likely it would have been. And it would have ended up costing the taxpayers a lot less in the end had we cared for his diabetes appropriately using Medicaid dollars. Another patient of mine, again, lost his Medicaid benefits because he was making slightly over the maximum income and stopped coming to see me. And in a short period of time, because he could not afford his blood pressure medications any longer, he now had a stroke at age 38 and needed to go on dialysis. We can't let this happen to tens of thousands of Virginians in my district. We can't let these cuts to Medicaid become a reality. So, as Congressman Whitman spends time back in this district this week, I hope he'll reconsider his support for cutting Medicaid. Now, I'd like to introduce Dr. Manolio to speak.
Good morning. I'm Dr. Rick Manolio, board-certified emergency physician with 40 years of experience. I'm here as well because I'm deeply concerned that my representative, Congresswoman Jen Kiggans, is supporting dangerous cuts to Medicaid. She also is avoiding holding town halls, but while she's back home in Virginia's 2nd District, I hope she'll finally listen to us, the people whose lives her voices or her votes are affecting. In her district alone, 130,000 people rely on Medicaid, including nearly 60,000 children and 12,000 seniors. Under the plan she supported, many of them could lose their care. That's not just bad policy, that causes real human suffering. As a physician, I've seen how access to affordable care transforms lives. It allows people to manage chronic conditions, avoid serious complications, and remain active in their families and communities. And as a healthcare provider herself, Representative Kiggans knows this. Without care, treatable conditions become life-threatening. Uncontrolled diabetes leads to blindness and amputations. High blood pressure causes kidney disease, strokes, and too often death. I treated a 34-year-old pregnant woman who didn't have insurance, so didn't get prenatal care. She arrived in my ER seizing and in a hypertensive crisis. Although we saved her baby, she died from a brain hemorrhage. Her husband was left with a premature infant, crushing debt, and a shattered life. There is no moral or medical justification for this. And yet, Representative Kiggans and others are pushing these cuts, not to balance the budget, but to pay for tax breaks for the ultra-wealthy. We, as doctors and as neighbors, are speaking out because we can't let this happen. These cuts are massive, hundreds of billions of dollars, and they will hit the most vulnerable people the hardest. Representative Kiggans, your constituents are watching. Your patients are speaking. It's time to stop supporting these devastating cuts. And now I'd like to introduce Dr. Lincoln.
Good morning. I'm Dr. John Langen. I am a U.S. Navy trained physician and have practiced at Eastern Shore Rural Health since 2006. I currently serve as the Chief Medical Officer of our organization. As fellow former naval officers, healthcare providers, and VMI moms, Representative Jen Kiggans and I have a lot in common, and we are well acquainted. Eastern Shore Rural Health provides primary medical, dental, behavioral health, and pharmacy services to over 70% of the 45,000 residents of the Eastern Shore of Virginia. Our region is more rural and has a higher percentage of low-income households than Virginia as a whole, which contributes to the need for a dynamic community health center and the support services that it provides. In 2014, 5,200 of our pediatric medical patients and 4,300 of our adult medical patients were on Medicaid, 30% of our overall patient population. In 2024, our school dental program cared for 4,400 children. Of those, 3,200, or 74%, were on Medicaid. And most of these would likely have gone without dental care if they did not have that insurance coverage. Since July of 2021, Virginia Medicaid has also covered adult dental services. As a geriatric nurse practitioner, Representative Kiggans knows how important dental care is in the management of chronic medical conditions and in preventing unnecessary emergency room utilization. In 2024, 2,700 of our 7,400 adult dental patients, or 36%, were covered by Medicaid. As these numbers illustrate, Medicaid is crucial to the survival of community dental care on the Eastern Shore of Virginia. Medicaid is critical to the health of community health centers, including those in Virginia. HRSA data confirms that over 400,000 Virginians currently receive care through one of our 27 federally qualified community health centers in the Commonwealth. Of those, 41% have Medicaid coverage. Since 2019, health centers have seen a steady rise in the share of their patients who have health coverage, resulting in more stable health center financing. But potential changes to the Medicaid program could reverse that. A drop in Medicaid revenue could result in a reduction in the services that community health centers are able to offer, both health services and other services designed to improve patient wellness. Finally, the health of community health centers impacts the health of their communities. Our stated mission is to serve all patients who seek primary care services, including those in medically underserved areas like the Eastern Shore. If our ability to improve community health outcomes, if our ability to improve community health outcomes and reduce barriers to healthy lifestyles is compromised by cuts in Medicaid, the overall health and wellness of the communities that we serve will be significantly impacted. The medical providers and elected officials of the Commonwealth have all taken oaths to serve, support, and protect our fellow Virginians. I urge Congresswoman Kiggins and her congressional colleagues to have the fortitude to withdraw their support for the significant cuts in Medicaid that are being proposed. Thank you.
Thank you so much, Dr. Lincoln, Dr. Manolio, and Dr. DiGiovanni. We'll now open it up for questions. If you have a question for one or any of the physicians, you are welcome to type your question in the chat box or in the Q&A, and I can help read through those. So we'll allow a moment or two for folks to be able to type those questions. And I had a question chatted to me. I'll read for the rest of you. Can you discuss how Medicaid could actually increase healthcare costs? I'm sorry. Can you discuss how cutting Medicaid could actually increase healthcare costs for everyone, including those who don't rely on Medicaid? And that's for whomever would like to answer that.
I'll answer that.
Go ahead, Susan.
Medicaid covers as a safety net. It can cover a lot of preventative services and treat illnesses early on. And when you don't do that, what happens is you end up going down the line, treating a lot of illnesses at their end stage, which drives up costs. You end up treating a lot of things in the ICU where costs are very high, and that results in a trickle-down effect to everybody else who ends up absorbing those costs. Because hospitals have to make up the money elsewhere, and the costs go up to the taxpayer, not necessarily to the individual person, but the taxpayer ends up absorbing those costs. And for example, that I gave, if we have treated somebody's diabetes early on and they don't have strokes and heart attacks and amputations and go on dialysis, you're saving enormous amount of money. Dialysis itself costs, somewhere in the neighborhood of $70,000 a year per person, sometimes more if they have to be hospitalized. And if you could prevent one individual from going on dialysis, the amount of money that we save in healthcare costs, and all of that is picked up by the government and the taxpayer. It is tremendous amount of money, and all it takes is treating people early on. And if Medicaid could pick up those early preventative services that prevent people from getting to those end stage illnesses, it saves a tremendous amount of money.
I would have to agree with that. In the emergency department, I'm probably in a unique position of seeing what happens when people don't get primary care through Medicaid providers. We saw so many times people that would come in with the end stages of disease, somebody with diabetes who is not on insulin, comes in sky high blood sugar, and has all kinds of problems. And again, ICU, you put these people in the ICU because you have no choice. And if they not only did they end up in the hospital because of not having a provider, but being in the ICU is extremely expensive. And unfortunately, hospitals need to stay in business. So they have to, I guess the word is balance bill, um, other insurance companies to make sure they have to basically raise their rates to make sure that they can stay open. And some of these rural hospitals, like on the Eastern Shore, I'm sure the one hospital there has to do that because they can't afford to treat people for free. And as much as I love taking care of patients, I would much prefer not to see patients for um, severe problems. And we see them even for coming in trying to get just their basic medications, their blood pressure medication, whatever else. They know they should be on it. They can't get a doctor. They come in, I give them their prescription, but then it runs out and they're in the exact same position again.
Absolutely right. On the Eastern Shore, we have one hospital for a 70-mile peninsula, and many rural hospitals throughout Virginia are struggling and or closing. If we were to lose our hospital, it would severely impact the health of this community. The Chesapeake Bay Bridge Tunnel is a wonderful transportation mechanism for those who can afford it. For many residents of the Eastern Shore, traveling over to Virginia Beach, Norfolk is financially, if not physically, impossible. And without a hospital over here, they will go without care.
Thank you all. Again, we have time for more questions. I have a couple more chatted to me, but if there are other questions, please feel free to put them in the Q&A and I can help moderate those. Also wanted to mention for those who have joined later, we are recording this and I can share a copy of the recording after the call. Next question, can you elaborate on how Medicaid cuts could impact hospitals and communities in rural areas? That's for anyone, but maybe Dr. Lingen, you might want to start with that. Again, it's can you elaborate on how Medicaid cuts could impact hospitals and communities in rural areas?
I think we just alluded to that. Without Medicaid, those people are going to show up in the emergency room sicker. They're probably going to require more care, possibly admission. That will be uncompensated care, meaning that the patients themselves will not be able to pay for it. So the hospital will either be required to provide that as charity care, or we'll need to find other ways to, to try and cover those costs. And as I said, you will see that there are hospitals that are either cutting services in rural areas or closing altogether because of their inability to stay profitable.
Thank you, and thanks for that question. There's another question in the Q&A from Adrian. Spending on healthcare has expanded tremendously since COVID. How do you recommend responsibly cutting costs? That's for anyone. Again, the question is, spending on healthcare has expanded tremendously since COVID. How do you recommend responsibly cutting costs?
I can only speak to community health centers, which I can tell you that a recent study done by the Congressional Budget Office has shown that we are actually able to provide high quality, low cost care, and we are very good stewards of federal dollars. So we are actively always looking to see how we can limit our costs and provide higher quality care and more services.
I would agree with that. And I think there are a lot of new programs. VCU now has a hospital at home program where they are treating patients in their homes that can be treated at home instead of being in the hospital. There are a lot more uh, programs designed to keep people out of the hospital who have complex chronic medical problems. We spend more in the last 6 months of a person's life than at any other time in the course of their lifetime. And I think that the more we start talking about those difficult discussions with patients and their goals of care and um, what they desire out of their, last 6 months of life, having more of those difficult discussions. What do they want? Do they want to spend, their end of life in an ICU connected to a lot of machines? Or is their goal more to be comfortable at home? With their loved ones, and how we can assure that that is, what they achieve for their end of life. I think that we need to have more of those difficult discussions. A lot of people shy away from those discussions, but when healthcare is not, we don't have little magic wands where we can cure people of everything. There are times when it's obvious that people are terminal, and we need to have those discussions with the patients and say, we're doing everything that we can, and end of life is near. What do you want for the remaining time that you have, and to have those discussions with the patients so that we're not spending hundreds of thousands of dollars in an ICU on a patient who all they really want is to spend the rest of their life at home with their family, as comfortable as they can be.
I strongly agree with that. Again, in the emergency department, we see patients all the time that come in near end of life. And unfortunately, very often, when they come in, that discussion has never been had. Families, as Dr. DiGiovanni said, nobody likes to talk about it. It's a difficult discussion. And some parents refuse to discuss it with their kids when the kids want to talk about it. But funding for these discussions, hospice care, stop doing futile care, keeping people in the hospital, and that is it. The ICU, you keep getting worse and worse and worse until you end up in the ICU. And many people in the ICU for months and are never getting any better. They have plateaued in the best we can do for them. And it's time to help them transition at home, to be with their loved ones in a familiar surrounding, and allow a natural death.
Thank you all, and thanks for that question. We'll allow another minute just in case there are any follow-up questions. Again, wanted to iterate that if you'd like a recording of this, I can share that after. You all have my email if you RSVP'd, so let me know via email if you would like a copy of the recording.
I have one other comment as far as making healthcare less expensive. Medications. Medications are ridiculously expensive. The pharmaceutical companies make a huge amount of profits, and it's medication. When you pick it up at the pharmacy, you're priced through your whatever plan you have, maybe $20 or whatever. But then you look at what the price of the medication is, and it's $480 if you didn't have that insurance. People that don't have insurance, Medicaid, or others are charged that $480. That's ridiculously horrible.
Absolutely. And there are some of my patients who are forced to have inferior medications, sometimes medications that have serious side effects, because Medicaid won't pay for some of the newer medications that have less side effects and are better for the patient, but are priced out of, proportion, and just can't possibly afford it because it's just unbelievably expensive to copays, $500-$600 a month or more.
you look globally at the rest of the developed world, we are the outliers. That is not the case in most other countries where medication costs are as out of control as they are in the United States. So that is one way we definitely could work to reduce the costs of medical care.
Absolutely. Oh, well, I'm not seeing any other questions, so we'll go ahead and conclude today. Thanks so much to those from the media who were able to join. We appreciate you taking time out of your busy schedules. And thank you so much, Dr. DiGiovanni, Dr. Manolio, and Dr. Lingen for your time and your advocacy on behalf of your patients and communities today. We really appreciate it.
You're welcome.
Thank you.
Thanks, everyone, and have a great rest of your day.